Go ahead and get started with tonight's lecture. Thank you all for joining me. I am Dr. Brianne Gober. I'm the founder of Glass Skin Aesthetics in San Diego, California. It is a new concept in aesthetics in med spas. It's a mobile med spa, and I will come to you wherever you are to make the process of going to the med spa less scary and less of an intimidating process. So let's go ahead and get started. Tonight we're going to be talking about PDO threads, and hopefully you've had time to read through a little bit about what tonight's lecture is. If you registered ahead of time, and if I see you in the audience tonight, then I will register you in the drawing, the monthly drawing, for a $50 gift card that you can apply towards your PDO thread treatment that you're going to want so much after you hear tonight's presentation. So here we go. This is just a little bit about me before we get started. So I have been a doctor since 2008. I graduated from the University of New Mexico School of Medicine, and I did my residency initially in obstetrics and gynecology. So if you see this lovely uterus back here, that is because I do have a lot of experience in women's health, which is it's still something that's really near and dear to my heart. So if you ever have any questions, don't be afraid to reach out, and we can talk about those things. I also spent 7 years doing chronic wound care, which is something that I still have a real passion for and I still practice. So this is my wound care practice right here. It's just something I like to make everyone aware of because it is still practice of skincare. So we have learned a lot about how our skin ages and how it works from knowing how it heals. So just because I have switched from doing mainly wound care to doing more of an aesthetics track does not mean that I do not know what I'm doing. It just means that I'm expounding on the vast knowledge that I have about how your skin works. So that is just something I like to make sure that everybody knows when we start out talking. I was also in the Navy, so that's why there's a lot of pictures of me in uniforms in there for 13 years in total. So introduction. So PDO threads. PDO stands for polydioxanone. It's a polymer. So it's basically a polymer that dissolves in your body by hydrolysis as it is in the fluids in your body after we implant it into your body. And what PDO threads are great for is they offer a non-surgical alternative for physically lifting and tightening sagging skin. So that's why you'll hear people talk about thread facelifts. But what we're going to learn tonight is that thread facelifts is not the only thing that PDO threads are great for. So we can do other things with them besides physically pulling the skin back. And they're becoming increasingly popular due to the minimal downtime of the procedure and the natural results that we get when using these. So it's really a great alternative. It's much more affordable than a traditional deep plane or plication facelift. But we'll go through and talk about why, this is really a great procedure, but you really have to be the right patient for the actual facelift procedure. There's lots of other things that we can do with these shorter threads, but for an actual facelift procedure, there are certain things that you need to be aware of, and it's not for everybody. So what are PDO threads? So we kind of talked about it a little bit already. They're made from polydioxanone, which is a polymer created in the lab. They're biodegradable sutures, and they are also a very popular type of suture that is used in the operating room. So these are not some fly-by-night crazy thing that somebody in the aesthetics field came up with. They're something that I used when I used to operate on women in the OBGYN world. PDO sutures, not necessarily just threads, are very popular because of the properties that they have. So they are absorbable. We'll talk about that a little bit more in a couple of slides. They're very safe. We know a lot about them. We've been using them for years, and they just happen to make a really, really good material to use this. There are other materials that we do thread lifts and thread procedures with as well that are used more in other countries, but in the United States, PDO threads are the gold standard. If you start going to other countries in Europe or in Korea, you're going to see lots of other types of threads. And there are some other threads that are in use in the United States, but the majority of the threads, all the different companies that you're going to see are going to be polydioxanone. And that's just because of the great versatility of the material. Originally, as I alluded to, these threads were made for medical use. So way before we started lifting people's faces and pulling back their skin and trying to make them look younger, we were using these in the OR, and we still use PDO suture in the OR. It's a great, strong suture, and it dissolves, and that's why surgeons like to use it. So it's not going to be a permanent suture, something that's going to be in the body causing inflammation for a long period of time, but it's very strong and it's really good to use in the deep layers, and that's why surgeons like it. It gets completely absorbed in the body within 6 months of using it, so it stays there long enough to create that strength that we want to hold tissues together. It doesn't dissolve, it doesn't get hydrolyzed right away. But it stays there long enough to give whatever application you're using it for, whether you're trying to get 2 pieces of skin to come close together because you just did an operation and you need to close that back together and you want that to be strong so that you don't have a surgical wound that's dehiscing, or whether you're trying to lift up and tighten the skin in someone's face. You also want to have a certain amount of strength there, but you also don't want to have something that's going to be staying around for a really long time and causing a lot of irritation in the face for a long period of time. So there's 2 main types of PDO threads that we're going to talk about tonight. There's a lot of specialty threads as well, but that's kind of beyond the scope of what we're talking about in this lecture. So we're going to focus on the 2 main types of PDO threads just to give everybody a good understanding of what there is if this is something that you've been interested in and you haven't really had the time to look into it. So the types that I think most people think of if they hear someone talking about a thread facelift would be the actual lifting threads. So these threads provide immediate lift and they stimulate collagen. And we're going to talk about how that happens in the next couple of slides. And then there's the non-lifting threads, or you might hear people talk about mono threads. And these really just focus on skin rejuvenation and plumping the skin and making the skin stronger and tighter. And these threads don't really do much lifting. They're not made the same way. And we'll see some pictures here in a minute so that you can better understand the 2 different types of threads and why they're different. Okay, so these are the non-lifting threads that we talked about. And so these are just a few. This is the company that I use, the supplier that I use, and the name of the company is Ilari. Feel free to look them up if you want to. There are several major companies that make polydioxanone threads that are distributed in the United States. There are also threads that are available that are not reputable. For example, you can order threads on Amazon. I would not suggest doing that. I have seen pictures of folks who are giving themselves thread facelifts, and I would not consider that a safe practice. So just because you see something on Amazon does not mean that it's a safe thing to do. And so I would encourage you to, if this is something that you're exploring, to really go to a professional, and I'm always available to answer questions. But just because you see it and you see other people doing it, this is a medical procedure, and you could really end up causing yourself some damage if you're not aware of the anatomy in your face. And it's just something that should be done with a sterile technique and with a lot of care. And also, you're not going to get the results that you want if you're not using the right amount of the material. It has a lot to do with getting the results that you want. So these are the most common types of threads right here. They are the mono threads. So this is the brand name, Ilari Pro Mono, but really what these are is you can see that there's a little needle right here, and it has a basically a suture, a little suture, and the sutures and the size of the needles come in varying sizes, but this is just a zoomed in view. And it's the suture is wrapped around the needle, and it goes inside of the needle, and then there's a little stopper on the end here, and this is what keeps it on. So basically, these are inserted into the deep dermal layer of the skin, and through various mechanisms that we'll talk about. All of these ones on this page help to improve the skin texture. They help plump it. They help create collagen. They help make your skin look better, and they improve the condition of your skin. But they are not going to be lifting the skin. Once these get put into the face, they stretch out to some extent, and they become more straight. So that's why many of the thread companies, and by the way, all of the thread companies in the United States really kind of have all of these different variations. They are manufactured much in the same way. They're the same material. They're just different brands. So, I'm showing you these, and I use Ilari, but that doesn't mean that the Mint or the other companies that are out there are not any good. But this is what they call a screw. So if you look at it, it looks very similar to this one, but it has two threads that are intertwined in a much tighter way around this needle here. And so that gives more material so that your body is absorbing more of this polydioxanone material, and therefore it's going to create more of a reaction, and you're going to get more of a benefit from it. But it's not something that we want to use in all areas. So these are all used in combination. This is an embossed thread. So if you look at it, you can see these they look almost like a string of pearls. These have more material than this thread, but also they have a good benefit in that if you're using them in areas around the mouth or in different places where you don't want them to really migrate, these little pearls help them stay in place. So that's why we would use those ones. Now, this is kind of a combination of the embossed and the screw. So you can't really tell very well in this picture, but it is got the double screw wrap just like this one does. And then it's also embossed. So again, you're getting that double benefit. You're getting more material, and you're getting the embossed thread so that it's going to stay put where it is implanted. And then last but not least, I think this is a really, really cool thread right here. It's hard to see because it's a small picture, but it's a braided mesh thread. So it's got 16 very, very, very small threads. 7/0 suture is extremely small, just so that you have a little bit of a comparison. A 5/0 suture is what we would use for very small, fine needlework when we're doing tissue repair at the end of a surgery or inside a surgery on very thin tissues that we don't want to tear apart. So 7/0 is even smaller than that. And they take all of these 16 of these tiny 7/0 threads, and they mesh them together into almost a tube. It's like a 3D tube. If you guys remember Chinese finger traps, it almost is like that. And so when this is inserted, it has also more surface area, more material, and this is a really good one for filling in fine lines and wrinkles and getting that increase in collagen formation. I'm sorry, let me get a drink here. To really improve the volume, and it's not going to be the same kind of volume improvement that you would see from let's say a dermal filler, but it is your own tissue that's filling it in because it's being stimulated by this. So there are different reasons that you might want to use or that your provider might want to use different types of materials to improve the tissue in your face. So these are all the non-lifting threads, just to go back and remember that. So the next slide is going to show us the lifting threads. Okay, so this is just kind of the general overview. And like I said, there are specialty lifting threads that are made that you can use for your nose, that you can use on the ears, that you can use to do all kinds of crazy things, but they're way beyond the scope of what we're talking about tonight. Tonight, we're just doing a basic overview of how thread lifting works, how it was invented, how somebody came up with it. And I just want to show you guys all of the basic things that we use. So this is a really interesting one right here, the cogs. So these are cogs or barbs. You'll hear people refer to this as a barbed suture and this as a cogged suture. So this is kind of where threads started, and it's probably the most common type of thread that's used because it's just the most prolific and the original type of thread. Now, these are more advanced threads, and we'll kind of talk about how they're made. So for all of these different iterations, the idea behind them is that they are, again, inside of, these are not the short little needles now. These are more like long trocars that are different lengths so that you can actually put them down along your cheek, along your jowl, and actually lift the tissue. Okay, so what happens is, as this is being placed inside of the deep dermal layer of your skin, everything is inside of the metal tube. So none of this is exposed, and it glides in really easily. The practitioner is trained to know what the anatomy is and what they're trying to avoid, and exactly how much pressure and all of that, how to get it into the right place. But once everything is in the right place, then the thread is released, and these little tiny barbs right here, they get buried and they grab on to the layer of your skin that they're in. And that is how we're able to reposition. So then when we pull on the thread, or if we push your skin up over the barbs, then it's grabbing on inside, and that's how we get lift. So the same thing applies for this guy right here. So as you can see, we've got barbs, and on this half of the thread, they're going one direction, and on this half of the thread, they're going the opposite direction. So the same thing happens with this one. You just can't really see it because it's a different pattern. So this thread right here is literally made by making a thread and then having a precise machine that cuts these little barbs into the thread. Now, that's really great, but it does tend to make this thread a little bit weaker. So as the people who design and come up with these amazing ideas went through and different iterations and different versions of the threads, they came up with these cones. So the cones grab onto the tissue just the same way, but they're more regular, and they are able to be stronger because the way this thread is made is totally different than the way this thread is made. This thread is made by 3D molding these cones in place. And the same thing for this one. This one looks kind of like a zipper. So it's got these kind of Z-shaped barbs on it, and they're molded onto the thread that way. So these two threads tend to be much more strong and can hold the tissue a little bit better without potentially breaking and snapping. And a lot of that also has to do with how large the thread is. And how large the thread is, just like the non-lifting threads, also has a lot to do with how much collagen production there's going to be. So these are what the lifting threads look like. And the reason that I show these is just to let everyone know that, you know, everything is not a scary barbed thread. Some of these are very, very short. Let's see, where's my camera? Some of these are very, very short and so thin that they're about as thin as a hair. So we can do a lot and get a really great effect without having to do anything that looks like this. And if you actually think about it, around the world, if you go to Korea, which is probably the place that is the most prolific thread using country, and a lot of the countries in Europe as well, they don't focus on the lifting threads as much. They really focus on using the mono threads or the non-lifting threads to create a more firm and youthful appearance of the skin. They really focus on using the mono threads for fine lines, nasolabial fold lines, for getting rid of jowling, for sculpting the jawline and things like that. And really for under the neck is a great place to get some tightness from the non-lifting threads. So while these are really great and they're fun for me to do, one of my favorite procedures, I think that people get freaked out by them often. So I want to make sure that people know that this is not the only option when it comes to threads. And I would love to talk to people about the different things that we can do with the mono threads by themselves, with these threads by themselves, or with a combination to really get your face into an amazing shape. I was blown away when I had my thread facelift. I couldn't believe the way that it just looked so natural and beautiful. And it was so fast. It was one of those immediate gratification things. So it's one of my favorite procedures to have and to do. So the next thing that I really want to get into is the history of PDO threads, because I think it's pretty interesting. And I like history. I like learning about why we have the things that we have. So I just want to spend a few minutes going through this. So in the late 20th century, which would be like the early mid 90s, is really when this concept of using suture, surgical suture for facial rejuvenation emerged. It came out of Georgia, the country. So it was a Georgian and Russian plastic surgeon. That's his name right there. I'm not going to try to say it. But he, was doing plastic surgery, and he noticed that whenever he was using a certain thread, that or whenever he went back in to revise a surgery, that there was a lot of tissue that kind of built up around the area where the threads were. They were not using absorbable threads back in the 90s. They were using polypropylene threads, sutures. Sorry, I'm going back and forth between the two. They were using polypropylene sutures. And so while in the plastic surgery realm itself, it was not ideal to get that much of the inflammatory tissue around the sutures, because it could make the scar look less than ideal. It kind of set off a little bit of a bell in his head that he thought, well, could we use this side effect, the side effect that we don't like, to get something that we do like or we do want? So he decided to try using these sutures in the face to see if he could get that reaction and try to move the tissue a little bit. So he started in about 1996 using polypropylene suture in some of his aesthetics and plastics patients' faces. And he did notice that it was working. So he was getting a little bit of an inflammatory reaction, and he was able to actually tie and lift the sutures and do something that caused a lot less of downtime for his patients, and they didn't have to have as much trauma as they were having with an actual surgical facelift. So that was the initial aim. So fast forward about 10, 20 years, and this procedure was gaining popularity. It had a whole, a whole school of following. He was teaching other people to do it. And then they started experimenting with the newer sutures that were out and available. And they started using sutures that were dissolvable. And what they noticed was that as these sutures were dissolving, they were getting that immediate effect. And as they were dissolving, they were getting more and more of the new tissue being formed. And by the time the tissues were dissolved at 6 months, there was actually a lift that was sustainable because there was a ridge of healing tissue that was holding it up. Now, it's not permanent. No facelift is permanent. So the lifespan of these procedures seem to be between 1 and 2 years, and the lifespan of a traditional facelift is anywhere between 5 and 15 years. So it's different, right? But it's different patients that can benefit from these different procedures. So as they went on in the 2000s, they started figuring out these different ways to improve the lifting effect. So this is when they started cutting the threads, making those little barbs that we saw. They started creating machinery that could mold the threads with the cones on them and the Z shapes that we saw. And then they really started seeing some great effect because they weren't just putting straight thread in and having to hook it into the skin and pull it up. They were actually making the procedure much easier, much less invasive, and people were really loving it. So we've talked about polydioxanone. That's the most common. This is going to be the most common material. And one of the other reasons is it's the only material in the US that is FDA cleared. So what does FDA cleared mean? You can hear FDA approved, FDA cleared. What it means is that PDO, the suture, is FDA approved. It's been studied, it's been put through all of these trials, and we know it's safe. So when the thread companies started coming, most of them originate from Korea, they came, and when you have something that is very similar in composition to something that's already been approved by the FDA, then you can submit to the FDA and say, we have something made out of the same substance. And so the FDA said, okay, you have these threads. They're made out of polydioxanone. We know that polydioxanone is safe. We've been using it for forever. And so now you have FDA clearance. So that means pretty much the same thing. Most of the PDO threads companies have FDA clearance for their product. Now, there's polylactic acid, PLA sutures, and polycaprolactone sutures, and these are used widely also in other countries. There are some PLA suture companies in the US, but they don't enjoy the same FDA clearance as PDO threads do. It doesn't mean they're not safe. It just means that they don't have that extra level of approval from the FDA. And really, they just are not as widely used. So it's just one of those things where if it were me out looking for this procedure, I would definitely be looking for someone who uses PDO threads because they're just the material that we have the most experience with here in America. And that's just the way to keep safe and to know that you're using a reputable product. A lot of these things are much more popular in other countries, and so some providers will order these things directly from other countries. That's not an approved way to do things. We have to buy them from the distributors that are approved for distribution in the United States. So that's always something to look for. So if you do come across someone using threads that are not PDO, I would ask them about that. I would ask them who's their supplier, where do they get them from, and what is the status with the FDA, just to be safe. And like I said, there is one or two PLA companies that are here in the United States, and if that's where they're coming from, that's great. But just to be safe, I would want to make sure that they're not coming from somewhere else who has different standards than us. And it's just to be safe. Okay, so now we're at the point of the modern modern times, so 2010s to present. PDO threads, obviously, we've kind of gone through this already. The sutures were already being used in surgeries, and that's kind of the reason that they became such a popular choice here and in other countries, is because we knew we've been using them for cardiac surgeries, we've been using them in gynecological surgeries, and we know that they have not been causing any problems. So when you're looking for something that you want to do for a totally aesthetic procedure, if you can know that it works well for a regular healthcare procedure and then it's been used in the industry for a long time, then that's definitely a way to go when you're looking at what kind of procedure you might want to do. We've already alluded to the fact that they're absorbed by the body within 6 months, but the collagen stimulation can last up to 2 years, which creates a longer lasting, natural looking lift. A lot of how long the lift lasts for depends on how you treat your healing post-procedure face in the first couple of weeks after the procedure. So we're going to go over that too. If you're not following the post-care instructions, then you may be loosening a lot of the cogs and the barbs, and then you may not get that long-lasting lift that you're desiring. And I think that that's something a lot of people are concerned about. So it's something to know that you're going to have to take care of a little bit while all of that nice tissue is forming around it. Okay, so now we're getting into the nitty gritty. How do these threads work? So we kind of alluded to where they're placed in the subdermal layer. It's little needles. They're the same kind of needles that are used when you go to draw your blood. But the barb threads, the mechanism of action for those, we already showed you what the cogs and the barbs look like. They anchor into the tissue. And so it's a actual mechanical, physical lift that's happening. So they're placed in, the trocar is released, and then when they're pulled tight, it's actually pulling. So when you go in for your consult, you're going to have somebody pulling and tugging on your skin so that they can see what it's going to look like when we get the lift. So it's not a shot in the dark. It's something that, we're trained to be able to pull on certain parts and know how that's going to pull on your skin. Now, the really cool part is this isn't where it stops. We don't just lift your skin and then walk away and say, okay, hopefully that works. There is a lot of science be underneath this. So when your skin, your body, any part has a foreign body in it, there's a reaction that happens. It's a sterile, mild inflammatory response. So this is what the Georgian doctor noticed when he was looking at his past plastics procedures. It creates this response where fibroblasts produce collagen actually around the threads. So it's not scar tissue necessarily, but it's a reactionary response that actually thickens the tissue. It holds it. So as the threads are dissolving by hydrolysis, this new tissue is helping hold it in place. Now, the reason that this lift isn't going to last forever because of this tissue is because your body also hydrolyzes this tissue. It's going on constantly, all of the time. Our skin is always remodeling itself. So you get a cut on your hand, you get a scab, the scab goes away because your body's remodeling that scab. You might get a little bit of a scar, and then your body's remodeling the scar. So our body is always remodeling itself. It's like a work in progress all the time. So we have this tissue that forms around the thread dissolves, and then our body immediately goes and it's starting to remodel this. But that gives us up to, 18 months, maybe a couple of years of an effect from this. Now, if you don't take care of the newly placed threads and you're ripping them out of your face, then you're not going to have the lift to get the scarring, to get everything to stay in place in the first place. So that's why it's important to take care of everything right after your procedure. And we're going to go through all of those instructions here in a second. The other really cool thing is, because of this this foreign body reaction, your skin is making all these new little blood vessels. It's called neovascularization. So this is improving the blood supply to the area where we're putting the threads in, which is increasing the cell turnover. It's bringing more blood to your skin. It's making your skin just have better texture, have better cell turnover, more collagen, all of the good things. And it's just bringing more nutrients to your skin, and it's just going to improve the way that it looks. And that's regardless of which kind of threads that we use. So even if we're just using those mono threads and they don't have any barbs on them, you're always going to get this neovascularization. You're going to get this inflammatory response. You're going to get collagen production, and you're going to get improvement in the way that your skin looks. And we kind of talked about this a little bit already. It stimulates fibroblasts. Fibroblasts are where we get our new skin cells. So this improves the texture. It makes your skin more elastic, and it just makes your skin look a lot better. So the next thing that we want to talk about is what happens in the long term. So PDO threads are biocompatible, which means that when we put them in your body as an implant, they're not going to cause any kind of a crazy reaction. They do cause a reaction. It's the reaction we want, but they're not going to be rejected by your body or anything like that. They are a implant that we've been using for decades, and they go really well in the human body and do not cause problems. They're very safe, and they're biodegradable within 6 months. So your body hydrolyzes them, and then they're gone. So they're not a long-term implant that are going to be there causing long-term issues. So the structural changes that they induce continue to provide lifting and rejuvenating effects. We've talked about this multiple times during this lecture. These effects can last 12, 24 months. There has been one study that was done where one physician followed a cohort of patients that he did these thread facelifts, and he had several patients that had lasting effects for up to 9 years. That's not typical, but it shows that you can have really great effects with this. So if you're someone who is the right kind of patient, then this could be a great procedure for you. Benefits. Obviously, if you're not wanting to have an invasive facelift surgery, then this is something that you might want to look at. But you're wanting to improve, some sagging skin, some wrinkles that you have, minimal downtime. When I had this done, I was back to my normal activities that afternoon. I was sore. I needed to put some ice on my face that evening, but I didn't look strange or like I had anything done. I had a little dot right here, and I had a little dot right here, and I went on. I was at a conference. I attended the rest of the conference. I had no issues, and it was just really fabulous. And it looks natural. I didn't look like I had anything done, but when people saw me, they said, "You look younger. What are you doing?" So those are the kinds of things that we're always looking for, right? We want people to notice that we look better, but we don't want them to think that we've had something done. So that is the beauty of using PDO threads, is that there is a perceptible difference, but people aren't sure what it is, and they can't tell that you've had something done. So it's really a great procedure in that regards. Okay. So plumping and revitalizing the skin, improving the skin texture, increasing blood flow to the skin, reducing fine lines and wrinkles, and enhancing the overall elasticity of the skin. These are all the things that we're trying to do. These are those imperceptible improvements that we want to have so that people say, wow, you really look a lot younger. What's going on with you? I can't figure it out. Like you're glowing. What's going on? And not necessarily, it looks like you've had something injected in your face. You look different than you did yesterday. It's just an all around improvement to how you're looking. Okay, so this is what happens when you come in to get a thread lift done. So we sit down and we figure out what it is that's bothering you. Like I said before, there's going to be a lot of moving, seeing where your tissues are, what they do when we move them around, because we want to see. We don't just go into this blind and start sticking things in your face. We have to see how your tissue moves, if you have nasolabial folds or if you have marionette lines, what happens to those when we pull on your tissue. So there's a lot that goes into the consultation. You'll probably get some lines drawn on your face. There's a lot of planning. This is a procedure that takes a lot of planning. And then you're going to get some local anesthesia. We're not going to go sticking needles in your face without giving you anesthesia. And depending on what types of sutures or what types of threads you're getting is going to determine the type of anesthesia that we're going to give you. So if we're just doing the little mono threads, then you're going to get some really strong topical anesthesia. We'll let it sit on there for 20 or 30 minutes. And then we're just going to be able to go for it. And you shouldn't really feel a whole lot. Now, if we're doing the big threads, then the way that we do that is with an injection of anesthesia, of lidocaine. And it's just a little subcutaneous injection or a dermal injection. And that just numbs the entry site. Once the needle is in your skin here, you're not really feeling a lot. So really, we just have to get the entry site numb, and then you're golden from there. Now, depending on how many threads, what areas we're doing, all of that, the procedure could take anywhere from 30 to 60 minutes. It's just a matter of the volume of threads that we have to insert. As far as pain management, most people do really well with just local anesthesia. But at my office, I do offer nitrous oxide in case you feel like you're having a little bit of anxiety or if you need some extra pain control. The nitrous oxide works really, really well. So don't be afraid to ask for that if you think that you might need it. And what you should expect after you get the thread procedure done, you're going to have a little bit of swelling. It's possible that you could have some bruising and redness. Most of this stuff is all going to subside within a week, if not less than that. You're going to be sore because, especially if we use the cogs, there's little cogs that are in your skin. So you're going to be sore for the first couple of days. Once the hydrolysis really starts to take effect and softens the sutures a little bit, they're not really dissolving yet. That takes 6 months. But once they start to soften, get more to your body temperature, and they're not as stiff as they were when we first put them in, then you're going to feel a lot more comfortable. The biggest thing is that if you're getting the cog sutures and you're getting a lift, you've got to be careful of these tips that I'm going to give you right now. You're going to want to avoid strenuous activities for a few days. And that's just because you don't want to increase the hydrolysis and dislodge them. So if you go to the gym and you're making, crazy gym faces because you like to lift heavy weights, or if you are going and playing on your intramural soccer league or any of these things, there's the chance that you could make a face that strains and dislodges some of the threads. There's a chance that you could get bumped and dislodge a thread. There's a lot of things that could happen. So if you could just relax for a few days and try to not do any of the strenuous activities, then that gives the threads some time to really settle into place and not get dislodged. If you have some discomfort afterwards, NSAIDs like ibuprofen and aspirin and those kinds of medicines are not great because there's just always the possibility that you're going to have a little bit of bruising and that it might get a little bit worse if we do something that thins the blood. But Tylenol is great. Actually, taking a little bit of Benadryl is great because the histamines that get released when we do these procedures tend to cause a little bit of swelling and a little bit more pain. So if we can do anything to make that process go down a little bit, that helps. Ice, especially the first day. You're going to want ice on that first day. It will help more than anything else. The second day is a little bit uncomfortable, but by the third day, you really forget that anything happened. When you've got these sutures in your face, you really want to try to sleep on your back. The first night, you're not going to want to do anything else besides sleep on your back. But when you start to feel more comfortable, you want to try to not sleep on your back for the first few days at least. And be careful taking large bites because if you open your mouth too large, you could dislodge the sutures as they are right next to your mouth. So who is the ideal candidate for PDO threads? So people who have mild to moderate skin laxity, and ideally people who are in the age range of 30 to 65 who don't want to have surgery. So here's the kicker. If you are someone who's in your 70s and you have a lot of hanging skin, you're not a candidate for this procedure. We can do the procedure, but it's not going to work well. It's not going to last. It's not going to look as great. And it's not going to be what you're looking for. If you are really concerned about your sagging skin and it's very saggy, then you are going to want to go talk to a plastic surgeon. And if you come to see me asking about threads, I'm going to let you know that that's probably going to be your best bet is to go talk to a plastic surgeon. If we were to try to do the thread lift, and you might get a month or 2 months of looking temporarily better, but it will quickly not look great because the skin is just too heavy. A lot of times it's too thin, and you can see dimples a lot more in the skin. It's just not ideal. So if you come in and ask me for a PDO thread lift and I think that you're not a great candidate, I will put you in touch with a really great facial plastic surgeon that I know. Other contraindications for all aesthetic procedures, if you're pregnant or breastfeeding, then I'm going to tell you to wait until after you're through that phase. There's not any known complications with most of the things that we do, but they have not been studied. So that's why we kind of step back from that. If you have severe skin conditions, or if you have an infection in your skin on your face, or if you have severe active acne, then those are things that we also are going to say, let's get this cleared up first, and then we can go in and do the facelift. We already talked about severe skin laxity or very thin skin, or if you have clotting disorders. So that goes back to the bleeding and not wanting to take the NSAIDs right away afterwards. We just want to make sure that we're not causing any undue bleeding. Okay, so we're getting ready to wrap up. Common questions that I get. Is the procedure painful? If we did not numb you, if we did not give you any anesthesia, if we were not to provide other things like a distracting method, which we have at Glass Skin, something to give you a little bit of distraction with a sensation that you can use on different parts of your body. If we didn't provide the nitrous oxide, the laughing gas, things like that, then yes, this could be a painful procedure. But we take all the precautions to make sure that you're comfortable during this procedure. And if you're not, then we'll stop and we'll make you comfortable. You're not going to be totally comfortable for the first day or so afterwards. And I think we've covered that pretty well already, but we have ways to make you more comfortable. Ice is your best friend. Tylenol is going to be great. And Benadryl are things that are going to make it feel a lot better. We talked about how long the results last, anywhere between 6 months to a couple of years. And that is, a lot of that is dependent on your provider and making sure that they use enough product. And a lot of that is going to come down to you and making sure that you follow those tips that we talked about in the last slide. Not sleeping on your face in the first couple of days, not going and having a giant cheeseburger right after you had the threads placed, all of those things. Are there any side effects? There's not really side effects to be said. There are times where you could start having a thread migrate or even come out of your skin. Those are things that we'll talk about during the consultation, and I will give you what you're supposed to do if those things happen. But this is an incredibly safe procedure. It's much safer than getting dermal fillers done. There are a lot of things that could happen with dermal fillers that really just are not a concern with PDO threads. So it is very safe. There's not really any side effects. The threads that we use are sutures that are used every day in the OR. So it's really a very, very safe and effective procedure. Myths. I think that a lot of people, we've covered this already, but I think a lot of people think that, PDO threads are some fringe procedure, but they are safe. They're FDA cleared, and they are something that have been used in other countries for a really long time. I hope we made that clear today. And the results are natural. They're not overly dramatic. They're not something that is going to look like somebody pulled your entire face back into a high ponytail, and that you're, have a constant headache from it. It really looks beautiful. It really just enhances. It can make your jawline just look beautiful and get rid of some of the sagging. So it's something to consider if you've ever thought about a facelift and think that maybe that's a little bit too dramatic for you. This is my contact information. So if you want to make an appointment, my phone number for my office is down there. Also, if you scan this QR code, you can get my entire business card, which has all of my links for LinkedIn, Instagram, Facebook, my YouTube channel, my website. A lot of the products that I sell are also included on here. So hopefully that was up there long enough for anybody who wanted to scan it. And this is just kind of a reminder. PDO threads offer a safe, effective, and minimally invasive solution for lifting and rejuvenating the skin. I hope that this was helpful for you guys. I hope that you learned everything that you wanted to. If you have extra questions after this, please don't hesitate to reach out to my office. You can schedule a complimentary consultation. We can go through and look at what your situation is, and if threads might be an option, or if a combination of threads and another procedure might be an option, or if threads just didn't seem like the thing for you. I offer all of the procedures, so don't hesitate to reach out. Now, next month, we're going to talk about something a little bit different. We're going to kind of move away from aesthetics for a little bit, and we're going to talk about longevity. So I wanted to ease into this topic and talk about the longevity loop. So this is going to be on August 27th at the same time, 7 p.m. It's always on a Tuesday night. And we're going to talk about the 8 essential factors that contribute to your biological age. I think that maybe some of you saw me taking the biological age test a few weeks ago. I have the results, but I'm not going to tell you them here tonight. I'm going to go live later on this week and reveal those results. But social connections, recovery, exercise, sleep, regenerative therapies, diets, supplements, medications, all of these things go together to make sure that we have the best, longest life. Not just the longest life. It's not only important to have the longest life, because if you have the longest, most miserable and disease-filled life, then that's not what anybody really wants. What we want is the longest, most healthy life. And we're going to talk about ways to start having that, because I think that we really need to start figuring out how to live our best life and our longest life. And there's lots of ways to go about that. And small changes in some of these areas can really make a big impact. So I hope that I see you guys next month. And thank you for joining me. I know I went a little bit longer than I thought I would, but thank you very much. See you next month.